geographic or community hotspots. So one of the areas that we're focused on this week and will continue to be for weeks to come is the 201 Poplar facility. We have had a very significant focus from a public health perspective on that particular facility, as well as corrections in general and juvenile justice, because we knew that those particular populations are more vulnerable for different reasons. They are in facilities where they're in very close proximity to each other. We know that COVID spreads very easily. It spreads 3 times faster than the flu, and we know how easily and fast the flu spreads. So there were significant efforts put in place before we ever had cases in any of those facilities to actually reduce entry into those facilities. However, we do know that we have essential workers that have come in and out of those facilities, and specifically with 201 Poplar, the individuals who are detained there come in and out much more fast and rapidly than they do at corrections. So on Friday of this past week, we worked in partnership with the Tennessee Department of Health, the Sheriff's Office, as well as WellPath, our correctional provider, and our staff within the Health Department to test 266 individuals. We have planned or anticipated we might test up to 400 or over 400, but ultimately tested 266 that were in very specific areas of the facility. And those test results started coming back over the weekend through yesterday. So at the current time, we know that there have been 155 individuals that are detained at 201 Poplar who have tested positive, and 37 employees who work within 201 Poplar that have tested positive. So we will continue to work with the sheriff to identify additional strategies for reducing transmission, but also for assuring that those individuals who have contracted COVID receive the appropriate medical care that they need, are appropriately isolated and quarantined. So I'm going to end there and turn it over to Sheriff Bonner, and when he's complete, we'll come back and open back up for questions.
Thank you, Dr. Householder. I'm grateful for the partnership with the local, state, and federal health officials in this collaborative effort to keep the detainees and my staff safe through this mass testing. My staff has been working under very challenging conditions. We owe them our deepest gratitude for pressing through these unprecedented times and showing unwavering dedication to our community and our agency. Currently, I have 50 correctional deputies, 4 law enforcement officers, and 3 civilians who have tested positive for COVID-19. Thankfully, several of them have recovered, and I'm prayerful that others will also. 2 of our employees are currently in the hospital and have been said to have been doing well. My office will continue to work with our criminal justice partners to responsibly reduce jail populations. All detainees that have tested positive, they are in the jail on felony charges, with the most severe case being first-degree murder. There are 1,790 detainees at 201 Poplar. There are 165 detainees at Jail East, and there are 61 youth detained at juvenile court. All detainees so far have appeared to be asymptomatic and have been relocated from their quarantine pod to a sterilized housing unit where they can be medically isolated and separated from other detainees. We're working with the public health officials to identify how these detainees contracted the virus. Thank you, Dr. Esper.
And we'll open it back up for questions.
Brad Broders with Local Memphis 24.
Thank you, everyone. 2 questions, one for Mayor Harris and one for Director Householder. Mayor Harris, there's been some talk. I know it was a unified front as it appeared on Monday, but on Friday, is there any belief or concern or possibility that any of the suburban communities might decide to reopen certain things kind of on their own, separate from Shelby County? And my question for Director Householder or Sheriff, just kind of a little more details about where those detainees have been moved, and your level of reaction to the number who tested positive, and any concern moving forward there.
Good afternoon, Brad. If it's okay, I'll answer, and then if the sheriff wants to add to it, and then we'll let Mayor Harris finish with the question that you posed to him. What was disconcerting to us from public health is that a significant number of those individuals tested were asymptomatic. We do know nationally that about 25% of people can be asymptomatic and still be able to transmit illness. So the consideration to go ahead and expand testing, which is what we opted to do last week, did clarify for us, particularly amongst a younger, healthier population, that people may be asymptomatic. What that implies for us is that we will probably expand testing even further. We'll be working with the sheriff and the state health department to make some further decisions about who else to test, but that was a higher positivity rate than we would have expected amongst that specific population, even though we knew they were in close proximity. So I'm gonna turn it over to Sheriff to make other comments and Mayor Harris.
Yes, Brad. With the detainees, our staff has done an excellent job in communicating with the detainees as to what's going on. And because of that, we have not seen a spike in incidents. We do provide them with medical, not only medical, but also mental health officials as well to talk to them about what's going on here. So I think one of the questions was, where did we move them? They are still inside of 201. We've moved them to the 6th floor. That particular area was sterilized before we moved those inmates up there. So we had no risk of them cross-contaminating. Even though they are testing positive, there were no other germs there before we moved them up on the 6th floor. So right now we have them on the 6th floor of the jail. We have additional staffing that's working with them and that is in that particular area. Mayor.
So the mayors continue to operate on the basis of consensus. We've had many work sessions as evidence of that. We brought the back to business framework, which was even further evidence of that, just a couple of days ago. With respect to the back to business framework, everybody was an equal participant. Everybody's perspective was heard and in fact listened to, and you see their perspective reflected in the final document. I have not heard any inkling among any suburban municipality to deviate from the consensus that we've all worked so hard to build. Thanks.
Bill Dries with the Daily Memphian.
Good morning. My first question is, where do you think we are in the much talked about 14-day window for us to move into phase 1? I mean, obviously you're still analyzing the results from over the weekend, but before that, were we close to the 14-day mark here?
So as I indicated yesterday, we are close. There's a variety of parameters that we're looking at. I want to remind people of those parameters. One is a downward trend or a flattening of the trend over a 14-day period, which is one incubation period. The other is hospitalizations and whether that's a stable trend, an upward trend, or a downward trend. We also have to look at public health capacity and our ability to be able to respond very quickly to cases so that we can get people isolated, and our ability specifically to respond to clusters, and then the hospital capacity to be able to provide services to those who need it, not only with COVID, but for others who may need services that are not related to COVID. If you look at capacity of both systems, we are in a good place, as was noted by Mayor Harris, as the health department needs to get back to regular business as well, and so we will look to increase staffing and continue to run 7 days a week to meet the needs of the community, but we're comfortable with where we are and our ability to staff up, so we're positive there. What we've done is look at the data several different ways. One is including the increased cases that came in over the weekend, and the other was excluding those particular numbers as well. There is still a little bit of a trend upward over the last several days, but we will look at that again tomorrow and the following days, that we may ultimately come with a completely downward trend. We look at the data day to day, and I know that sometimes that's not clear. It may appear confusing, but it is, how does that look day over a 14-day period? So we're very close. I want to remind people what I shared yesterday. We have to stay the course at this point. Really, social distancing has made a big difference. We want to continue our social distancing. We want to make sure that we're screening people who come into the workplace, particularly essential workers, that we're covering our mouth and nose with facial coverings and really practicing good hygiene. And I think with all those measures in place, we will be close to opening fairly soon.
And I read over the 13 pages of further guidance that came out Tuesday that Dr. Randolph talked about yesterday. And these are some pretty complex steps that everybody has to go through, including the businesses. How much of a head start or lead time do you think that they need to know that you know, some of them can reopen on X date? They need to know a date pretty soon, don't they?
I'll make a few comments, but then Mayor Harris may want to make a few comments as well from his position. One of the reasons that we've gone back to daily press conferences is we want to make sure that people know we are getting very close so that they can begin to prepare and be ready for when we're able to say that we can open. And we do recognize that all businesses are a little bit different. Some may need more technical assistance than others. Some may need a longer lead time. But by giving the daily updates and us acknowledging that we're much closer to opening than we were a month ago, I would really encourage people to begin to prepare, not wait for the announcement that, yes, we're ready to open. And then I'll defer to Mayor Harris for additional comments.
I would echo those comments. I think we are very close, and so I would encourage businesses to prepare. So if you have inventory, for example, there's no reason why you shouldn't take steps to prepare to make sure you have inventory in place if that's a long process. The other option, however, is even once there is a date announced based on the data, you need not necessarily open that very first hour or that very first day. That you can take things on your own timetable. And so that option will remain available, and there's every expectation that there will be some businesses that decide not to open in that very first hour or even on that very first day as they take some of this on their own timetable. Thanks.
Jackie Massey with Fox 13.
Hi, how are y'all doing today? I had two questions, both for Dr. Haushalter. So according to the framework on the website, it says that we need to meet the criteria for sufficient lab capacity to process tests, and also says that we need to work on a rapid test turnaround time. How are we looking right now, and where do we need to be? And my second question is about the hotspot zip codes. Can you talk a little bit more about those efforts to focus on them, and why do you think there are more cases in those areas like Hickory Hill, Parkway Village, and the 38118 zip code? How are we combating that?
So specifically about lab capacity, we have sufficient lab capacity, and I know there's been a lot of national dialogue about lack of capacity and lack of testing supplies. As I've said from the beginning, we have been able to meet the needs of those who need to be tested locally. We want to continue to expand our capacity to actually get people tested, but the lab capacity is there. We have a variety of labs who are doing the specimens now, and they move fairly quickly. About a month ago, our turnaround time from when a specimen was taken to when the health department received a report could be as much as 6 to 10 days. That caused significant delays in getting people isolated. The turnaround time on average now is 24 to 48 hours. And then one of the other things that we've done differently to promote early isolation is that for all the community testing sites, we have standardized the education that occurs at the testing site so that people know they have to be isolated the moment they're tested, and that once the results come in, they remain isolated. And that's critical to us reducing transmission. We've also standardized a tool that anyone can use to identify their contacts. So once someone's tested, they're given a sheet to be able to start to identify their contacts so those individuals can be quarantined. And so it's the combination of lab capacity, lab turnaround time, and the ability to early isolate and quarantine that'll reduce transmission. And we're much better now than we were a month ago, and look to continue to tighten that up as we see where there might be gaps in the system. As far as targeted testing, I'm going to talk specifically to 38118 because that's the zip code we brought up. What we do know about that community as we geomap the actual addresses where the cases are or individuals who are quarantined, these are people who live very closely together in the same neighborhood. And so we do know that there's transmission based on family relationships, social relationships, and other, not just neighborhood social relationships, but individuals who may go to the same facilities, and they may or may not have been practicing good social distancing. So outreach has been educational materials to that community. We've had some direct outreach to leaders within that community, and we anticipate adding additional testing in that community as well. But I will note, once we began to talk about it here, we've actually seen that the positivity rate in that community has started to go down. So we also believe getting the messages out through media is helping people know that they have more transmission in their community and they're improving social distancing.
Jacob Steimer with the Memphis Business Journal.
Hi, Director Haushalter. You said we're very close. Two questions about that. One, multiple suburban mayors said they were hoping for May 1st. Is that still a possibility? Or would the earliest be after that? And two, why is this point in time potentially safer to have businesses open than March 24th when we closed them down, when we have 2,300 active cases now and had about 80 back then?
So I'm not going to give an exact date, and I know everybody wants a date. I have to let the data drive me to a decision and a recommendation, and then defer to the elected officials to determine the date that's most appropriate for Shelby County. So I'm not avoiding your answer, but I'm answering it in a way that's appropriate from my position. What's significantly different about now than on March 24th is we know that there are several things that have changed significantly. We do have more cases. That's a cumulative number over time, so they continue to go up. But the exponential growth day to day has actually slowed significantly, stabilized, and over the last 10 days or so began to decrease. What that indicates to us is we have less transmission occurring in our community. We've also increased testing, so we know that more people have had access to testing, and that even through that increased testing, we've had this downward trend. So again, a sign to us that there's less community transmission and that social distancing has worked. We also look at what's called the duplication rate. So we know internationally that initially the number of cases duplicated every 5 to 7 days. In Shelby County, we've stretched that out considerably. The last time I looked at that number, it was somewhere around 8 to 9 days, but it's probably even further out now. Another sign that there's reduced transmission, particularly at the community level. And then we also look at the replication rate, which is if I'm infected with COVID, how many other people am I likely to give it to? And that when we first implemented the social distancing measures, safer at home, stay at home orders, we know that one person was giving COVID to about 4 or 5 other individuals. We're now down to about 1 to 1.2 or 3. We want to get that number below 1, but we know by that significant change that, again, we've reduced transmission in our community. We've also monitored social distancing, and while we have had some challenges to compliance, I want to reiterate that overall most people have complied, and we believe that people will continue to exercise appropriate judgment and take the actions necessary to protect themselves, their families, and the community.
Brandon Richard, WMC 5.
Yes, good afternoon. Going back to the 400 detainees that you had hoped, or the 400 people you were hoping to test on Friday, can you explain why you weren't able to test all 400? Who determines which inmates or detainees get tested? And also, Dr. Householder, another issue, can you explain why some areas might have a higher positivity rate, be they zip codes or different cities or even different states, than others?
Okay, so specifically to the number 400, as I noted, we asked for some technical assistance from the state. I specifically requested one epidemiologist that I've worked with before who does extensive and has done extensive work in correctional facilities. He joined us by phone for several meetings, and then he came down and spent a day with us. He assisted us in making the estimate based on capacity in those geographic areas within the facility. So we're looking at specific pods, number of staffing, the number of people who could have been in the pod, and came up with a number of between 400 and 450. That's how many test kits were taken to the facility. But my understanding that ultimately all of the detainees except one who may have refused were tested. And please remember, even though individuals are detained, they have a right to refusal. And so that one individual refused. And then there were the staff that were tested, as well as some WellPath staff that were tested, ultimately equal to 266. There are some other individuals who were not able to be tested that we will expand testing to them probably sometime this week.
Stacy Jacobson with WREG.
Hi, can you hear me?
Yes, go ahead.
Okay, good. Sorry, I had some issues yesterday. Thank you again for taking our questions. I have a couple of things. But first off, specifically about the inmates, you said that you haven't identified yet where they got it from and you still don't know. So what are your theories about where they got it from, and how long do you think it'll take you to identify that, and have any of them been hospitalized? And then I have a separate question after that that's not related to that. Thank you.
Okay, so yes, there has been at least one individual that I'm aware of that's hospitalized or has been hospitalized. And my earlier comments about the source is that it's very difficult to determine the exact individual who was the index case in this particular situation. And so I would not want to say, oh, that it was individuals who worked there that brought it into the system, or it was a detainee who brought it into the system. We will look at where people moved within the facility. We will look at when people entered the facility, which employees were positive, and movement within the facility. But the truth is that ultimately we may not pinpoint an index case. What we want to focus on as the highest priority is reducing ongoing transmission. Identifying the actual root cause is a later priority, in part because we don't want anybody else to contract COVID at the facility, whether it's an employee or a detainee.
Thank you. My other question is about testing. We've talked a lot about, and today, once again, you reiterated the desire to increase testing, but as of today, only 43% of the tests available are actually being administered. So how are you planning to get that number up, since this has become a trend?
It's really important that we get the message out to the public of the importance of testing, and we're going to rely heavily on the media to help us with that. Also with social media and all of our municipal partners to help get the message out. But anyone who has even very mild signs and symptoms of COVID should be tested. That's a little bit different than the original guidance that was given by me in part with the CDC and their recommendations. Initially, people were told to stay at home, but clearly what we want people to do is get tested. We will also expand testing to some very key targeted areas, such as nursing home employees and other vulnerable communities. But we want people to know that it's safe to get tested and that it's important that they get tested.
We have time for one more set of questions. Final questions go to Katie Reardon with WKNO.
Hi there. My questions are for Sheriff Bonner. I know that there has been an effort to reduce the population at 201, but I'm wondering, with the current population that's there, what kind of practices are in place to ensure that people can safely socially distance within, I'm sure, your public safety parameters? And then can you talk about access to just basic hygiene in terms of soap, water, and what that looks like for inmates?
Well, it's very difficult to practice social distancing in a jail. You have to remember this facility was built almost 40 years ago, and this pandemic was not even thought of during that time. Now, what we've done in the jail during this process, all inmates have access to soap, hand sanitizers. We're always cleaning the jail. About 2 weeks ago now, we've issued all inmates as well as all of the workers, the correctional deputies in the facilities, masks. So we're doing all that we can do to fight this virus, to slow it down in our facility. As I said, the inmates that were moved up to the 6th floor, we had a company to come in and sanitize that area. And so we're fighting it in every way we can. We're seeing this going on in all correctional facilities across the country. I read daily reports and talk to other people that are in this business, and everyone is struggling with this now. So because of the close proximity that all inmates have, it's very difficult, but we have been able to reduce the population at 201. I think our count now is about 381 since January, which is a reduction of roughly about 17%. So we're going to continue to work with our law enforcement partners, the judges, the Attorney General's office, to see how many more that we can release safely out into the community.
All right. Any closing statements from any panelists? All right, this concludes our briefing. Thank you, everyone. Please stay healthy. Please stay safe. We'll see you tomorrow.